I always enjoy the opportunity to talk to Rotary Club, not just because of who you are, but because you all understand that many of the issues and challenges that we face are always a great deal more complicated than people want to make them seem. And COVID-19 is no exception. This is both a complicated issue and one that's evolving quite quickly. And so in the course of my talk, the next 3.5 hours, I will show you a number of slides that have actually been updated as recently as this morning. So to give this talk, I want to divide my comments into four quick sections. I want to talk a little bit about background information. I'm going to talk the current status of the pandemic with a focus on the United States and on Tennessee, and then talk a little bit about what the future will hold. And then the question people want to know is, when will it be safe to return to normal? In terms of background information, I think it's always worth taking a few seconds to make sure we all have the same language, talk about the same issues. And in the media, sometimes the coronavirus, SARS-CoV-2, and COVID-19 are used interchangeably. Coronavirus is a group of viruses that affect mammals and birds. There's a variety of different coronaviruses, sort of like talking about wild cats, right? You've got tigers and lions and leopards, you've got genets and servals. There's a variety of coronaviruses. SARS-CoV-2 is the name of a particular coronavirus. It is the one that causes the current pandemic. The disease is called COVID-19. So SARS-CoV-2 causes COVID-19, though we tend to use COVID-19 to talk about all of it. That's what the artists tell us that SARS-CoV-2 looks like. That's what the electron microscope. Either case, if you see that coming towards you, I'd suggest you move the other direction. As mentioned, it's a group of viruses that affect mammals and birds. There are 7 strains that cause human disease. 4 of these are pretty mild and basically cause what we would call the common cold. Probably 1 out of every 7 times you get a cold, it's caused by a coronavirus. Of more concern are the 3 more lethal ones: MERS, Middle East Respiratory Syndrome; SARS, severe acute respiratory syndrome; and then COVID-19. All of them have been discovered in the past 20 years. So even though we've known about coronaviruses since the 1960s, these highly pathogenic ones have just come along in the last. I'm just reading the comments. Anyway, these are the ones that we're worried about have come along in the last 20 years. They have some considerable differences between them, perhaps most notably the rest of their death rate. So MERS, about 1 in every 3 people who gets the disease has died. SARS, about 1 in 10. But COVID-19 is unknown, but quite a bit lower, 0.2 to 3% perhaps. We don't really know for sure. Based on those numbers, you would think that the diseases would have been considerably more different from each other in terms of the impact on the world, but in terms of MERS and in terms of SARS have been less than 1,000 deaths, whereas with COVID-19, we're well over 200,000 deaths worldwide. As most of you know, many people who get COVID-19 have no symptoms at all. They're not sick, or they have very mild symptoms. However, others get a combination of some or all of these factors, in which the last 5 have been added by the CDC in the last couple of days, and then a small percent of people die. Though it's not always the case, those who die seem to be those who've had pre-existing conditions, particularly heart disease, diabetes, chronic lung problems, high blood pressure, and obesity, and especially those that are older. In New York City, half of the deaths have been those over 75, and 2/3 of the deaths have been folks over 65. So that's sort of the background information. So let's look at the pandemic itself, what's actually happening worldwide. Basically, disease has been reported from virtually every country that has a reliable reporting system. This is a chart that I made a week ago when I started working on this talk. At the time, there had been 165,000 deaths in the world. In the past week, that's gone up by another 50,000. So it's a pretty rapidly growing, expanding disease. There have been 3 million cases confirmed worldwide. But both of these numbers, the cases and the deaths, are significantly underreported. In the U.S., a week ago, we had 40,000 deaths. Now we have 56,000 and over 1 million documented cases. As I say, both of these are underestimates. A report just came out yesterday, and I took this off the internet today. The gray line here is what we call the seasonal average. That's the number of deaths we would expect in a week in the United States. And you can see that it's higher in the wintertime and it starts to come down. The black line is the actual number of deaths we have seen, and you can see that from the middle of March on, we've seen a significant spike in the number of deaths. That's what we call excess mortality. That's how we measure the impact, for example, of flu every year. But also what you can see is only about half of those have been ascribed to COVID-19. The other half have not been. So that includes some deaths that were COVID-19 that have not been accurately reported because the people weren't tested. And then also some other diseases, or maybe even folks that have heart attacks or strokes who didn't go into the hospital because they were afraid of COVID-19. But this points out pretty clearly that the numbers that we're seeing are underestimates. And you can see from this that the U.S. is lagging behind the rest of the world. In other words, our epidemic is starting a little bit later. You can also see it in this chart here. This compares the number of deaths per million population for the countries in Europe where the epidemic has been in place longer. There's the U.S. And you can see that we're still only about a quarter as many deaths per million. Now, there are a variety of possible explanations for that, but one of them is that we're simply earlier in the pandemic than they are in those countries. Where you see this difference most dramatically, though, isn't in looking at the U.S. versus other countries. It's looking within the U.S. This is a chart that I made yesterday. This is deaths per million by all 50 states. And there's Tennessee, that tiny little red line right there. And you can see if you compare Tennessee to New York, they have 40 times the number of deaths. Now, some of that is due to their density, how close people live together. Some of it's due to when the epidemic hit. Some of it's probably due to the duration of the pandemic in each place. But it does give you a sense that there is still going to be growth in Tennessee and most of these other states that are still in the double digits in terms of deaths per million. That's what our chart looks like, cumulative cases in the state of Tennessee. As of yesterday, Tennessee had almost 10,000 confirmed cases and about almost 200 confirmed deaths. Again, these numbers are significant underestimates for reasons that I'll show you in a moment. There have been COVID-19 cases in 93 of Tennessee's 95 counties, clustered again, as you would expect, in the larger metropolitan areas, as have the deaths as well. So that's the sort of the current status. And the question everyone wants to know is, what's the future going to be? What's the next couple of months of this pandemic going to look like? And I can say definitively right now, we don't know. And we don't know because we don't know what kind of pattern this pandemic is going to have. So, for example, if it's like the 2002-2003 SARS outbreak, and many of you remember that, it was a coronavirus disease. It appeared suddenly. It started killing hundreds of people. And then in a matter of 2 to 3 months, it was basically gone. So if that's what COVID-19 is going to do, we're probably in pretty good shape. We'll see maybe a few more cases and then it'll burn itself out. On the other hand, COVID-19 could be more like the annual flu that comes back every year, slightly mutated, some years worse, some years better. In the average year in the United States, we lose about 36,000 people to the annual influenza, and that's even with a vaccine. And so if COVID-19 is going to be like that, we will expect to see a seasonal return with various mutations from year to year, meaning really the only thing that will help us will be a vaccine that we update on an annual basis. The third possible outcome would be if SARS is like measles. For those of you that remember the pre-immunization era, measles is one of those diseases that affects virtually everybody who's vulnerable. So it spreads widely. There's not much you can do about it until you have an effective vaccine. And the measles outbreaks that are going on in the United States right now tell us what happens when we step away from the protective effects of vaccines. So even a coronavirus vaccine may not protect us if people won't get themselves and their children vaccinated. The worst model, and the one that's fortunately not likely to happen, is that it will be like the 1918-1919 Spanish flu. It occurred first in the U.S. and Kansas. It was a relatively mild disease in the springtime. It seemed to get better in the summer, and then it came back in the winter and fall with killing up to 50 million people worldwide. And the problem is, without knowing what model this is going to be, you really can't predict what the future is. And let me show you why we don't know that much about it. So with apologies to those of you that are actually infectious disease experts, this is a simplistic model of what an infectious disease typically looks like. You start with a population that's susceptible. These are people that could get the disease. Then they're exposed. One of two things happens to someone who's exposed. They either get the infection or they don't. If they get the infection, they become infectious. That means they can expose others. If you're not infected, you're still susceptible. So once you've got a group of people that are infectious, two things are important. First, they can now expose the other people around them who are susceptible, but also they can get sick. And with SARS, with COVID-19, it can range from no symptoms at all to death. Those who don't die, we assume, will recover, hopefully fully, some partially, and then they become immune. That's your simplistic model. Why can't we know more about this? Because right now we don't know how many people are infectious. We simply haven't done enough tests. We haven't been able to test for people out there. Those that we have tested have typically been those that were extremely ill. So by only knowing that, we don't know how many people have recovered, and we don't know how many people are immune. And the third thing we don't know is a little bit esoteric, but at least some reports coming out of China and South Korea suggest that some people who have been infected, who seem to have gotten better, may get infected again. We simply don't know that. The fourth thing we don't know, of course, is we've been engaged in very active social distancing. We've stayed home. We've not had large meetings. We don't know what's going to happen now when we start to back away from those social distancing. So if we can't predict the future, how will we know when it's safe to return to normal? And the answer, of course, is no one knows for sure. And the important thing, I think, is to understand that it's not black and white. This is not a simple question. If the only question we were answering is from a disease standpoint, we'd say, hey, never go back to normal. Always protect yourself until the disease goes away. But there's a lot of other issues involved. There's economic issues. There's infrastructure issues. And I think the governor has put out a reasonable approach to systematically returning to normal. Some people might argue with the timing of that, but my concern with it is not the report itself. It's that many people will look at that and go, okay, everything's back to normal. We can return to normal. And of course, the governor's report doesn't say that, and I don't say that. I think if we are going to open up, we have to realize that this isn't over. We're still seeing new cases. And whether we open up now or not, we're going to continue to see new cases. So we need to maintain social distance. We need to wear masks when we go out in public. We need to practice good hygiene. One that people aren't talking about but is really important is we've got to be careful about penalizing people who stay home because they're ill. Many people, especially those with minimum wage jobs, if they don't go to work, they don't get paid. And so there's a strong motivation for people to go to work, even if they're mildly ill. And we've got to figure out a way of getting past that so that people don't go to work when they're sick. There have been various debates about what that approach could be. I'll leave that for others. We have to do much more widespread testing. We have to know who is immune and who's not. Once we have done that, we have to do what we call contact tracing, identify people who've been exposed. You isolate those who are infected, you quarantine those who've been exposed. And most importantly, we have to assiduously protect the elderly. I'm very concerned that as we back away from social isolation, as we need to do at some point, we've got to protect those in nursing homes, long-term care facilities. And obviously, we have to be ready to re-isolate if it comes back stronger than we anticipate. So from a graphic standpoint, it looks like this. We need to stay with social distancing as much as we can. We need to keep susceptible people away from those who are infectious. Secondly, we've got to test people as many people as we can to know who is in fact infectious. And once we do that, we've got to do contact tracing and quarantine. And we've really got to protect our elderly and others at risk to reduce the death rate. When we do that, then we can return to normal. The analogy that some of you have heard me use is it's a little bit like a house fire, right? It starts pretty small. When this first occurred, reasonably, we thought, okay, this is not that big a deal. We can deal with it. As it starts to get further and further out of control, we realize this is beyond what we can do. We've got to call in reinforcements. We've got to do social distancing. We've got to shut things down. We've got to take it seriously. And as now that we're getting it under control, we can't back away from all of those things because there's still a little bit of fire going on everywhere. And we want to make sure that it doesn't spread to new regions. So I like to say, be smart, stay apart, take it seriously. We do need to open up. We do need to start getting back to normal, but we need to do it in a systematic and cautious way. And we need to make sure that we take those steps that I laid out before.